So what is the agenda for today? So our agenda for today are the following. So we will be discussing the marking criteria. How are you actually going to pass this station? So we will be objective on what is needed and how to pass the examination. And of course, at the end of our marking criteria, probably we'll just be discussing the marking criteria like in 15 or 20 minutes. And the remainder of our session, we will be reading the prescription. I will be showing you sample of prescriptions. We will be reading the old examination and the new examination. Of course, I will be showing you a sample of a community drug chart. So please stay tuned. So for both examination, you will be given 15 minutes to do this station. Okay, so Legacy 2014, and if you're doing the new test of competence, you will be given both 15 minutes. Okay, and for both examination, you will be given black pen. So on this particular station, the only document that you have is your drug chart. So remember our conversation in our previous webinars, all those documents will disappear once you go to this station. Okay, once you go on this station, all the previous documents will disappear because you no longer need those documents when you reach this station. You have to remember the rights of medication administration because it's imperative that you determine that your prescription or your drug chart is correct. Okay, it's correct. And the essential information is there and your prescription is valid. So do I need to enumerate all the rights of medication administration? Probably you know it now. So how to pass the implementation station? We will now dive into the marking criteria and we will discuss this objectively. So for you to pass the examination. So the one I'm showing you is the marking criteria for the new test of competence. So again, M or Y are not showing the marking criteria for the old examination. It's basically the same. Okay, it's basically the same. So number one, of course, you have to perform your hand hygiene and make sure to identify that your environment is safe for obvious reasons. Okay, so I will not be discussing on how to perform your hand hygiene because we've discussed it in our previous webinars. So make sure you follow the steps based on the WHO guidelines. So same with what I mentioned before, you don't have to say the steps of the hand hygiene. Just perform it, just do it, okay? And that should be enough for you to pass the examination because the assessor could see you're doing it. And safety environment, make sure there are no fall hazards and that you are safe to carry on the procedure. That is it. Emmer, could also add with regards to, let's say, privacy and dignity. Of course, you could say that as well, that you will provide privacy and dignity of the patient. But based on our criteria, it's not written there. Yeah, but if you want to say that, of course, you can do it as well to make your implementation station better. But there are no brownie points for that, okay? There are no brownie points for that. Assessment criteria number 2, introduce yourself to the patient. So similar to what we've discussed last time. So you make sure you introduce yourself, your name, your role, and of course, the reason of your visit. Probably you're here to administer the medication. Okay, you're probably here to administer the medication. So on your task, later I'll show an example. You will find what time of the day you're meant to administer the medication. Let's say 8 o'clock medication. So as part of your conversation, probably I'm here to administer your 8 o'clock medications. Okay, so that is your introduction. Short but sweet. The next one is to gain consent. Okay, so ask the simple question like, is that okay? Or are you happy for me to proceed? Of course, you cannot carry on if the patient doesn't consent for the procedure. Okay, so remember, gaining consent is important for all your stations. So number 4 is to identify patient and check for allergy. Of course, it's important that you identify the patient. So you need to ask the full name. In the UK, we follow first name and then surname. So date of birth. So the date of birth in the UK, we follow the different format. Of course, we're not following the American format. So the date of birth is in here is the day, the month, and the year. So if you're still in the Philippines, you might not get used to it. It will take some time, yeah. So to adjust to it. So normally we know in the Philippines it's like month, day, year. In the UK, day, month, year. Okay. So you ask this information from your patient. And of course, hospital number. Do you need to ask that information from the patient? Of course not, because the patient will not remember their, or I don't even know my hospital number. Yeah. So make sure you check the patient's ID band and compare it with your existing document. And of course, the allergy. So you could ask the question. So let's say the patient's name is Emmer. Emmer, do you have any allergies to food, drugs, or latex? So you could specify what are the possible allergies the patient might have. And of course, the reaction, okay? The reaction from the allergy. After hearing the allergy, of course, you have to reassure that you are not administering any, let's say, any food, drugs, or latex where the patient is allergic with, okay? So I have to reassure that. And of course, similar with your full name, date of birth, and hospital number, you have to compare your document with the patient's ID band. Okay, Emmer, is there like an instance wherein um, the ID band is different to the patient's document? So far, to my knowledge, there is none. Okay, to my knowledge, there is none. Because if you want to, let's say, because the main focus of implementation station is to administer a medication, not to trick you in terms of identifying the patient correctly. But again, it's of course, you have to ensure that the patient's detail corresponds with your document. Okay. Another tip for this station is if the patient is allergic to something, most especially medication, there is a higher probability that it may appear on your drug chart. Okay. Let's say the patient is allergic to penicillin. So keep an eye on that. It may appear on your drug chart. Okay. It may appear in your drug chart. So please be careful. So make sure you know your penicillins. Okay. So normally penicillins, most of their names, it ends with cillin, like amoxicillin. Okay. But there are medication, of course, containing penicillin, not ending with cillin. So the next criteria is you have to read the prescription and make sure you have to ensure that the prescription is with the correct person, drug, dose, date, and time of administration, correct route, diluent if appropriate, the validity of the prescription, the signature of the prescriber, and the prescription is legible. Okay, so those are the important things you have to ensure before you administer any medication. Okay, so later I will show you. I will be showing you 3 prescriptions as an example. So we will show you the old drug chart, the new drug chart, and of course a sample of a community drug chart with the new test of competence. Assessment number 7. So you have to consider contraindication where relevant and medical information prior to administration. So I'll give you an example. Let's say, going back to our quiz earlier, digoxin, digoxin is a digitalis, it's a cardiac glycoside. So of course, before administering digoxin, you have to make sure or to check the patient's heart rate or pulse rate prior to giving this. Of course, if you cannot give this, if the patient's heart rate or pulse rate is below 60. So Emmer, do we need to actually check the patient's heart rate prior to this? No, you only need to ask the assessor about that information. Okay, you can ask the assessor. Assessor, may I know the patient's heart rate or pulse rate or the blood pressure if it's necessary. Okay, for certain medications. Another example is, let's say you're administering amlodipine. We all know amlodipine, it is for the blood pressure. So of course, prior to administering amlodipine, you have to make sure that the patient's blood pressure is within normal range and it's not too low. Another example is medications for diabetes. Okay, your oral hypoglycemic agents such as metformin. Of course, prior to administering this, you have to make sure or you have to ask what's the patient's current blood sugar levels. Of course, you cannot give your metformin if the patient's blood pressure or blood sugar rather is low. So remember, in the UK, we follow the millimole per liter as our unit of measurement for blood sugar. But if you're following, like I know back in the Philippines and we follow the American textbooks, we all know milligrams per deciliter. Okay, so in here it's 4 to 7 millimoles per liter. So that is an example of your number 7. Okay, so number 8 provides a correct explanation of what each drug being administered is for to the person in their care. So it's a must that each medication that you're administering, you have to explain what that medication is. Okay. So one of the instruction that the assessor will be giving to you is to please talk to your patient and explain what you're giving, not giving, and why. Okay. So later I'll read the instructions for you on this station. Okay. So again, let's say I'll give it an example. Say bisoprolol. Of course, you will not tell the patient that this is a beta blocker. Okay, so you only need to give a simple explanation to your patient, or just simply say this is for your, let's say, example, blood pressure, and that's it. Okay, as simple as that. You don't need to like go through the pharmacokinetics and pharmacodynamics of the drugs. Okay, just explain it as simple as possible. And number 9, administer drugs due for administration correctly and safely. Okay, it's just echoing the previous assessment criteria. And number 10, omit drugs not to be administered and provides verbal rationale. Of course, if you're omitting your medication, you have to say or state the reason why. So later, I think on my example, I hope there's one we're in. Remember, guys, that omission is different to a medication not due yet. All right, omitting a medication is different to a medication not due yet. So later we will tackle it. Of course, the possible examples are, let's say the patient has an allergy with a particular medication. Of course, you are omitting it. You're not giving it because there might be an instance we're in, even if the patient is allergic to penicillin, it may be prescribed on your drug chart. Okay, so that is one of your example. Next, number 11. So you need to ensure that you accurately document drug administration and non-administration, including the details of the person administering the medication. So far, for the new test of competence, we've sent a lot of people for that examination, and so far, our candidates are failing because of not completing the documentation. They said, Emmer, the drug chart is too long. Okay, 50 minutes, not too long. So during your practice, whenever you train for your implementation station, you have to be aware of your time and your speed. Candidates are failing because of not completing the documentation, most especially not writing the omission codes. Okay, so that is your criteria number 11. And this is the last criteria. Okay, we are now done with the criteria. So number 12 is you have to act professionally throughout the procedure in accordance with NMC code. Okay, be professional at all times. Okay, that is it. This one is self-explanatory. Okay, so of course, if you're like frustrated with your examination, do not yell at the assessor. Okay, you have to respect the assessor and the actors on the examination. Any question in terms of our marking criteria? So those are the steps you have to ensure for you to be able to pass your implementation station. If you want to watch the steps, or if you want to watch the videos for implementations, I will not be playing it today because I think it's 50 minutes long. Just go to my YouTube channel and find the implementation station there. Okay, so there is an example on how are you going to perform implementation station. The only problem is they are reading the old documents. So hopefully we could publish our new video for the implementation station. Okay, so that is it. Any